is Lacey Schooley, and today I'll be demonstrating how to prepare and administer insulin. So I was just with the patient and there was no signs of hyper or hypoglycemia, and the CNA checked her blood sugar and it was 178, so I'm going to go ahead and prepare her insulin for her. So I'm going to perform hand hygiene before I enter the med room. Okay, so in front of me I have my MAR and my physician's orders. So I'm just going to check them and make sure everything matches and is correct. So on my MAR, I have Shirley Coast, 54-year-old female, 05/14/1964. And on my healthcare provider's orders, I have Shirley Coast, 54 female, 5/14/1964. So I have the same patient, so I'm going to go ahead and compare the medications. So I have demi-dose NPH insulin U100, demi-dose NPH insulin U100, 15 units subcut daily with supper, 15 units subcut daily with supper. The next one I have demi-dose regular insulin U100, demi-dose regular insulin U100, 10 units subcut BID, 10 units subcut BID. Okay, and then the last one is I have Practi Insulin Lispro U100 insulin pen, Practi Insulin Lispro U100 insulin pen, and that is subcut TID with meals, and I'm using the mild sliding scale. So I'm just going to check my scales and make sure all the values on my MAR and my physician's orders are correct for when I figure out the dosage. Perfect. So they match, so everything matches, so I'm good to just work off my MAR now. So I'm going to begin my first medication check, and before I do that, I'm going to check my MAR to my medication bin. So I have Shirley Coast, 54 female, 05/14/1964. Shirley Coast, 5/14/1964. Perfect. Okay, so my first medication I'm going to pull out is the demi-dose NPH insulin U100. So I have demi-dose NPH insulin U100. Okay, and then since this is a multi-use vial, I have to check the patient. So I have Shirley Coast, 5/14/1964. Shirley Coast, 5/14/1964. So this is the right insulin for the right patient. And then the next one I have is the demi-dose regular insulin U100. So I have demi-dose regular insulin U100, and again it's for Shirley Coast, 5/14/1964. So the correct insulin in the correct patient. And then the last medication I have on my MAR is the Practi Insulin Lispro pen. So I have Practi Insulin Lispro pen U100, and again Shirley Coast, 5/14/1964. So that matches, so this is the correct pen for her. Okay, so I've done my first medication check. Everything matches for my bin, so I'm going to go ahead and start my second medication check and prepare my medication. So I'm going to put on gloves. Okay. So for the NPH insulin and the regular insulin, I checked my drug guide, and I can mix them. That way I only have to administer one shot to the patient instead of two. So I'm going to go ahead and do my second medication check. So I have the demi-dose NPH insulin U100, demi-dose insulin NPH U100, Shirley Coast, 5/14/1964, and we'll be giving 15 units of that. And then the demi-dose regular insulin U100, demi-dose regular insulin U100, Shirley Coast, 5/14/1964. Okay, so both of those insulins are correct. So since they are multi-use, the caps are already off, which is fine. I'm just going to clean the tops for 5 to 15 seconds, or 10 to 15 seconds, sorry. I'm going to clean the regular one first, circular motions, and then before I clean the top of the NPH, I just have to roll it in my hands. That way I get all the particles mixed up. Okay, so once all the particles are mixed up, I will clean the top of that vial with a different alcohol prep pad. Okay, again, circular motion, 10 to 15 seconds. Perfect. Throw this away. Okay, so now I'm good to go ahead and prepare my medication. So I'm going to grab an insulin syringe. Just make sure, so this is 29 gauge with a 1/2 inch long needle, so that's the correct size for a subcutaneous injection. So pull this out. Okay, so for the demi-dose, the NPH insulin, I am going to be doing 15 units. So since I'm going to be drawing that one up second, I need to put the air in first. So 15 units of air. I'm going to put that into the NPH. Perfect. And then for the regular insulin, it's 10 units. So I'm going to draw up 10 units of air. Sure it's right on the 10. Okay, and I'm going to inject that into the regular insulin. And then I can go ahead and just draw up that. So draw up 10. Okay, so I'm going to drop a little more just because I do have an air bubble, and since it's the first insulin, I can go ahead and flick that out. So I'm going to place this down, and then when I recalibrate it, I'll have my second nurse verify the dosage. There we go. Okay, so I got the air bubble out, so I'm just going to recalibrate it. Okay, so I'll have the second nurse verify that I have 10 units, and then, so for the purpose of the video, it would be the camera, and then they would sign off on the MAR saying that yes, I do have the 10 units. So now I'm going to go ahead and get the NPH, so I need 15 units. So altogether in my syringe, I'll have 25 units of insulin. Making sure not to inject any. Draw down. Perfect. So then the NPH, the 15, which altogether will be the 25 units, which is what I have. So I have my second nurse, or the camera in this case, verify, and then initial on my MAR. Okay. So I'm going to go ahead and recap this because I'm all done. So using the scooping technique, I'm going to push down at the base until I hear the click, and then I am going to write out. Okay, so insulin 1 was the regular, and 10 units of that, and then the NPH, God, my pen's not working. NPH, I had 15 units, and then I'm gonna initial, and it is 7:15, and then date. Perfect. And I'm just gonna place that around the syringe so that when I go in the room, I can do my third medication check. Perfect. Okay, so this way I can place these back in the medication bin because I'm done with them. So then the last medication I have is the Practi Insulin Lispro U100 pen. Practi Insulin Lispro U100 pen. It's for Shirley Coast, 5/14/1964. Shirley Coast, 5/14/1964. So again, I have the right pen. So the CNA told me that her blood sugar was at 178. So on my mild sliding scale, I'm going to give 2 units. So to start, I'm going to take off the cap on my pen. And I'm going to disinfect the top, again, 10 to 15 seconds. Just because I'm going to be putting a needle in there, and I want to make sure it's nice and clean. Perfect. So for that, go ahead and grab my needle. It's the 30 gauge and the 3/16 inch, which is the correct size for what I'll be doing. So I'm just going to twist the needle on just until I feel resistance. I don't want to tighten it any further than that because I won't be able to get it off. I'm going to take off the cap, and I'm going to prime it to 2 units. Okay. And then push up. Okay. And I saw the bubbles come out, so it is nice and primed. So then I'm just going to put it back to 2 units and have my second nurse, or in this case the camera, verify and sign off on my MAR. And then when I'm done with that, just because it is needle, using the scooping technique, I'm going to put the cap back on and place that on my tray. So now everything is, all the medication's prepared, it's been checked. So I'm going to clean up my workspace, take off my gloves and go ahead and enter my patient's room. I'm gonna knock, perform hand hygiene. Hi Shirley, how are you doing? I'm Lacey, I'm gonna be your nurse today, okay? We're gonna be administering your insulin, okay? So the patient has food in front of her, so that we can go ahead and give both of the insulins. So I'm just gonna have you verify your name and date of birth for me. Okay, Shirley Coase, 5/14/1964. Shirley Coase, 5/14/1964. Perfect, that's what I have. And then do you have any allergies? Codeine. Okay, that's what your band says, and that's what my MAR says, so we're good to go ahead. I have nothing with codeine, so you can go ahead and administer all your medications, okay? Okay, perfect. I'm just gonna put some gloves on. And then where do you normally put your, administer your insulin, Shirley? In your abdomen? Okay. Well, we'll just go ahead and stick with that if that works with you. Perfect. Okay, I'm just gonna put this side rail down, that way it can work a little easier. Perfect. Okay, so I'm just going to expose your abdomen. Okay, still providing privacy for the patient. Okay, so I'm just going to go ahead and clean this area. Circular motion, 10 to 15 seconds, okay? Perfect. Okay, and now while that dries, I'm going to go ahead and do my third medication check. So for this one, we mix the NPH and the regular insulin for you, okay? So this has an onset of 30 to 90 minutes just because they're mixed. So I have regular insulin, 10 units, which is what I have, and then the NPH, 15 units. Perfect. So everything matches, so I'm going to go ahead and give this to you, okay? Okay. Okay, Shirley, so I'm just going to pinch your skin, okay? And then on the count of 3, you're going to feel a slight poke, okay? Okay, 1, 2, 3. The hub is flush with the skin. And I'm just going to slowly inject this. That way, if there's any burning sensation or discomfort, hopefully it'll minimize that for the patient. Perfect. Okay, Shirley. And then on the desk, I'm going to engage my safety and put it right into the sharps container. I'll go this way. And I'm going to document, so my initials, that was on the left lower abdomen. And then again with the regular, was on the left lower abdomen. Perfect. Okay, and so the next one I have for you is your insulin pen. And you use that at home? Perfect. So we're just going to go on the other side of your abdomen, okay? And again, I'm going to clean that. And I can go ahead and give this to the patient because she has food in front of her. And so since this insulin is fast acting, it will start working within 5 to 15 minutes. So that's why I need you to eat right after we administer it, okay? Perfect. So while her skin is drying, I'm just going to do my third medication check. So I have Practi Insulin Lispro U100 pen, Practi Insulin Lispro U100 pen, a Shirley Coase, 5/14/1964, and then it's still at 2 units, it hasn't moved, so it's good to go. Okay, that skin's dry, so we're going to go ahead and do this insulin pen, Shirley, okay? So again, I'm just going to pinch your skin, and you might feel some pressure, okay? So I heard the click, it's flush, so I'm going to go ahead. I heard both clicks for the 2 units, and I'm just going to hold it in there for 6 to 10 seconds. Just make sure all the insulin's out. Perfect. Okay. When I release it, there's the red, so I know the safety has engaged. I'm going to take it off right away, throw it into the sharps container, and place the insulin cover back on. Okay, Shirley, I'm just going to cover you back up. I'm going to document this last one. So my initials, and I give it into the right lower abdomen. Perfect. Okay, I'm going to put your side rail back up. I'm just going to hang out for about 15 minutes while you finish your food. Make sure you don't have any symptoms of hyper or hypoglycemia. Okay, and so then after that 15 minutes, I will perform hand hygiene. After I'm done, make sure the patient has the call light, which they do. Do you need anything else, Shirley, before I leave? No, you're good? Okay. So I will exit the room and document everything we've done.